How's it going, everybody? Dr. Robert Berghorn here, physical therapist and owner of Ascent Physical Therapy, bringing you another episode of Tactical Tuesday. And I'm very grateful to be here again with you guys on another beautiful day. It's a little bit on the chilly side for me, but I'm hoping everybody had a good weekend, is getting back out, and is still doing things in order to stay fit, healthy, especially as we're starting to wind down from the season. You know, where everybody's getting out, and all we have left now after the marathon season is turkey trots, ho holiday runs, and we also have even that Dark Stride series that's coming up, that Star Wars Rogue One series that's coming up, which I may be actually doing. So I am definitely considering that. It is something that I do want to do as more of a fun race, a fun run, so that I'm able to like break it open as I haven't been competing for the past few years and start getting back out there and competing. So what we're going to be talking about tonight is a little bit about not feeling so great after you run. This could be directly after you run, during your run. It could be during the next day. Some people, especially recently, I've been hearing that there's a lot of people feeling like they've been beat up, or people that have saying that they go from one run to another run, a couple of days, and they don't feel their best. They don't feel like they can. Yeah, they either don't have the energy, they don't have the stamina. They feel like they are in pain periodically throughout their runs or after their runs. They feel uncomfortable, especially when they're sleeping at night. So we're going to go through a couple of things of why that could be going on for you. We're going to go through a couple case studies of clients I'm seeing currently, and also case studies of people I've seen in the past, and figure out for you if this could also help you as well if you're not feeling your best during, after, or even before your runs. So let's get into it. So one thing I always like to talk about with people is, especially when they come up with this question for me, is why I do not feel my best after my runs? This could be a number of factors. One of the big grand scheme of things, especially when we start talking about your training, especially if you're with a coach or if you're not with a coach, what does your training plan look like? What does your racing plan look like for the coming year? Is it something that you've done before? Are you taking a huge step as you're coming through and going through your training or your racing pace or your racing schedule? Is it something that's too much for what you're doing? Are you overtrained? And that's something that, like that's a big general one that people can throw out, and something that can be get you in the way of not having the best results. Especially if you are overtrained. If you're overtrained, you do have a fatigue. You do feel like you're beat up all the time. You do feel like you're not necessarily getting the rest and recovery that you need to do, so that over time your performance decreases instead of increases as you're approaching your races. So being mindful of what your training plan looks like, being communicative with whoever you're working with, whether that is a coach, someone who's doing your programming for you, making sure you're staying open in your conversation, making sure that you're talking about what is best for you, and making sure that you are, feeling good. You shouldn't feel when you have pain during your runs. You shouldn't feel like you have pain, or you shouldn't feel like you feel beat up the next day. I mean, if you do have a hard training run one day, you may feel a little sore. And soreness is okay as long as it goes away within 1 to 2 days. But if you're having that repetitive day after day of just achiness, or if you're having spots around joints, or if you're having issues within bones or joints as far as pain, that's not necessarily the most okay thing that you want to have be going on, especially if it's repetitive or recurrent and something that just doesn't go away. So some of the things I want to talk about also is some corrections that you can make initially that can be simple and easy, especially when it comes to running form. Running form is very important. Running is a very complex movement, and it is something that does need to be analyzed. I do these analyses regularly with my clients. I do them either when they're running exactly on the road, or I slow it down and put them on a treadmill, and I have the video breakdown for them. Some people have talked about, oh, is going on a treadmill a little bit different than running on the road? Ultimately, no, because you are still going through the same kind of mechanics. You are going through the same level of motions. Is the belt doing a little bit of different things? Yes, it can be. That's why I do video both on the treadmill and I do video off the treadmill of different movements that you're supposed to do, and different and also different runs and different camera angles to make sure that I'm getting the appropriate things I need to see, so that I can give you the appropriate corrections for the future. But some things that you can do right away in order to help correct some of your runs is making sure that you're landing with your foot underneath you. I know that can seem very like something very, very simple when you just say it, but it can be very difficult. Some people I've worked with, they feel like they've been told that they need to put their foot underneath them when they accept their weight, instead of putting their foot out in front of them, trying to reach or overstride. But then I show them the video and that their foot is landing still out in front of them. Sometimes just seeing that video is very important for you, especially if you get your race photos and you're taking a look at your race photos and watching where your foot's landing. If you're not having your foot land directly underneath where your hips are, you could be giving yourself a little bit extra force and a little bit extra energy that you have to deal with. Some other things are if you have increased sway side to side, that's something you can fix up real quick too. If you're noticing that you're going from side to side when you're running, or if your head's bobbling side to side like I'm doing right now, you may be wasting some energy. Running is a very forward and backward motion. There are different segments are moving forward and backward. If you're noticing that you're having a little bit of a trot, or if you're having a little bit of a shuffle from side to side, you may be wasting some of that energy where you could be propelling that for you forward. So definitely if you're dealing with anything with that, that could be coming from whether you're crossing your body as you're running. It could be coming from just you having too wide of a stance when you're running. So if your feet are too far apart when you're hitting the ground, that could be happening too. If you have a little bit of weakness in your core, your hips, you could be having some stability issues in your spine that could be throwing you off and making you go from side to side. So that could be one thing as well. One thing that I've noticed, and I'm going to talk about it in one of our case studies tonight, is one of my clients. He was dealing with him kicking the inside of his ankle every time he would run. It was always that same kind of the ankle. So sometimes when that happens, it's generally from when you have a drop in your hip or a drop in your pelvis, and that's usually from strength deficits or decreased body awareness. So if you know that you're clipping yourself as you go through and you're running, that may be one thing that you're dealing with as well. So let's go through a couple of the case studies, things that I've been seeing with patients recently and clients recently, and some things that I've seen in the past. So this client that I was seeing, she's dealing with shoulder pain while she's running. This is someone this is someone that I was treating with, went through his gait analysis, and he was pretty surprised about how many things that he had going on. He was a pretty good runner. He has a pretty good pace. Regularly, he goes 7:30 and below for his mile time, and he can do that repetitively over number of miles. He can do that and hold that pace for almost about 10K. So he is very good at what he's able to do, but he has deficiencies that could make it even better if he corrected them. So he was dealing with shoulder pain, and basically it was shoulder pain on the right side. But the real issue wasn't coming from his shoulder, it was actually coming from his left hip. So basically his left hip was dropping, and this was also the same client that I had that was scuffing his right foot on his left ankle every time he would step through. Basically what was happening as he's dropping his hip, basically that requires him to bend his knee even more in order to pull through. It also requires him to pull his shoulder forward in order for him to come through because of the weakness he has on his left side to compensate. And because of that, he was developing overuse of his shoulder. He was getting pain up throughout here and his upper trap area and up into his neck. This was also someone who has been dealing with knee pain on that left side, the same hip that was dropping. And the reason why he's scuffing, because as he's scuffing his ankle as he comes and runs through, is because as he's dropping his hip, it's also shortening where his leg is, his leg on the other side is compared to where his left leg is on the ground. So every time he would swing through, his gait or his stance is very narrow instead of being wide where it should be right at his hips. So because you're dealing with shoulder pain somewhere, it could be related to the way you're running. You don't necessarily have to have upper body pain in order to relate to something that's going on up here. It can be coming down from all the way down at your foot and radiating, not necessarily radiating, but emanating up here because that is a weak point for you. And is the way that you specifically are compensating. Next case I want to go through is someone who I've been seeing or have seen in the past who is dealing with rib pain and breathing pain. This was someone who was working out and doing strength training, and somebody who was developing imbalances because of the way that this person was strength training, and as a result was more forward dominant instead of back dominant, which you do need to have a little bit more balance and stability, more back balance, so that you're able to stay more upright. You're able to develop more power as you're running. And because of that, this person developed breathing pain. So anytime that this person would breathe, especially deeply when they were running, they would have pain and spasm that would not only just be in the back of the shoulder blade, but also would wrap around to the front of the chest. Now, of course, this was ruled out. It was ruled out by the emergency room. It was ruled out by urgent care. It was ruled out by me of not having any heart issues, not having any heart attacks, that kind of thing. So that was all ruled out. But it was wrapping around. It was wrapping around up to the left side, and it is something that I do see periodically. This isn't something that I always see. It is something that can manifest only because this person is dealing with some imbalances, not only just from being unstable in the shoulder, but she's also having a little bit of imbalances in her hips as well, based off of the way she runs, and it's something that is affecting her to be able to push off, to be able to run periodically. So especially when this person was stressed, when this person was having decreased amount of sleep, so this person who was not eating regularly, and also if they were not drinking regularly, they noticed that this issue would pop up again. So making sure that you are getting enough sleep, making sure that you are drinking enough during the day, making sure that you're eating the right way, and also making sure that you're doing the appropriate strength training where you have balance between the back of your body and the front of your body, where there is that 3-to-1 ratio of having more strength in the back than you do in the front, because a lot of us, we do a lot of activity in the front. We don't want to end up with our shoulders nice and rounded over, so that we're able to function, we're able to stay upright, we're able to move around the right way. We're also able to have the appropriate mechanics and strength and stability so that we're able to continue running and doing our activity. Now, we have a couple more. So this one person that I'm currently seeing, she was dealing with midfoot pain, so pain that was right in between the second and third toe. Most doctors would consider that as like Morton's toe, Morton's neuroma, because she was getting radiation and some electrical kind of pain between her toes. She was having issues as far as like pressure on her foot, so she was having a little bit of metatarsalgia as well. Initially, she's had injections in there. She's had injections. She didn't necessarily have physical therapy for it, but she was told that she couldn't run anymore and she shouldn't be running anymore because she was getting older. But she wanted to give this a try. So she was been working with me. Within the first session, she was able to start jumping and doing her more high intensity classes that she's been missing out on for the first time in over a year. And she was also able to walk barefoot without any pain. So that's definitely one thing that we've been working on. We are getting back to starting to run again, but we're working on a few more mechanics. She has some restrictions within her foot that we've been working on mobility-wise. So, not only neglecting your strength training, but if you're neglecting your mobility training as well, it is different from just stretching. So if you are neglecting mobility and strength training, you could be doing yourself a disservice. So if you are having trouble with any of that, especially if you're dealing with foot pain, please make sure that you are not only making sure that you know what you're doing, but you're also practicing it yourself and finding a different program or special program, or getting in front of a professional like me who can break that down for you and making sure that you're able to get to the appropriate mobility so you have appropriate push off with your foot, because whatever happens with your foot affects everything that goes up all the way up to your head. And the last one, pain in the front of the knee with landing. So this is one of the clients that I've had recently, and basically he was having pain right in front of the knee anytime he would put any pressure that was over walking. So if he did any kind of jog, he would have pain right in the middle of his kneecap, and he would have pain anytime that he would push off and run. Now he wouldn't necessarily have pain as a result of overstriding, or he wasn't landing with his foot in front of him. He was just having more issues with his ankle. He's had a previous history of ankle sprains, and he's had issues with rolling his ankle still. But when I take a look at him, especially when I took him into with his knee bent, I did notice that there was ankle mobility issues, and sometimes that definitely happens, especially if you've had your ankle immobilized in an ankle brace or a cast after a severe ankle sprain, or if you've ever had ankle surgery. So making sure you're getting that appropriate ankle mobility back after you have surgery or after you have any kind of significant ankle sprain, or even if you have a mild ankle sprain, you do want to make sure that you have the appropriate mobility, because that affects how everything else, like I mentioned before, goes up the chain. For him, everything was breaking down at the knee itself, instead of at the ankle where the initial injury happened. So don't always think about that the pain is where the cause originates from. Making sure that you're getting an understanding of where your pain is coming from, and fixing that problem the appropriate way is something that is going to be most appropriate for you. Uh, I hope that that was just a few of the cases that I've been seeing recently, and also have seen recently in the past that applies to this different topic. Um, there's a lot of different things I could be talking about. There's a lot of things out there that I've seen that don't get addressed by other professionals and other clinicians, where they either not only just ignore it, but sometimes they just bypass it like it's not a problem. And they people do notice breakdown over time, and it is something that does need to be corrected and can be corrected regardless of your age, regardless of your fitness level, and regardless of your status as far as a competitor or a recreational runner. So if you're dealing with any running pain, if you're dealing with anything, regardless of where it is in your body, if you're dealing with any pain while you're running, or feeling like you're extra beat up after your runs when you feel like you should be a little bit more rested, please feel free to reach out to me. I'm more than happy to sit down with you, talk to you, whether that's on the phone, in person, or on Zoom, so that I'm able to either get you on a treadmill or get you out on the road, and we can break down your running form and figure out what's best for you and the next best steps to get you 100% and bulletproof for 2022. I hope you guys have a great evening, and I'll see you guys next week. Have a great night, everybody.